Hi, welcome back to the channel. I'm Nurse Obi, and today we are diving into something really deep. We are diving deeply into anxiety. Did you know anxiety isn't just worrying? There are actually several types of anxiety, each with unique symptoms and challenges. Do you know that when you understand what anxiety really is, it leads to you being compassionate, and also it also helps with better coping mechanism. You may ask, what is anxiety? Anxiety is a natural stress response. There is normal stress response and there is anxiety disorder. Normal stress response is response to an external stimuli. Example, respond to a deadline. And normal stress response ends after, or it subsides after that particular situation has been resolved. But anxiety is a persistent state of excessive worrying and fear. It can lead to persist even without a clear external trigger, and it can significantly interfere with your daily life. Both anxiety and normal stress, they can actually manifest in a similar way. Studies show that 40 million adults in the US are affected by anxiety. The main types of anxiety disorder we'll be discussing is one, generalized anxiety disorder, what they also call GAD. Generalized anxiety disorder is consistent worrying about daily life. Someone is always worrying about daily life, thinking, oh, how can I do this? How can I do this? How can I do that? There's always fear, always fearing that something bad will happen, even when things are okay. Number two is panic disorder. Panic disorder is a situation where there's a recurring panic attack. There's a sudden fear, a sudden heart racing. Your heart is racing. Example, when someone is feeling like you are dying, somebody is feeling like he's dying during an attack. Number three is social anxiety disorder. Social anxiety disorder is kind of an intense fear of judgment in a social setting. Example, someone is avoiding to speak in class or even at work meeting. The number four type of disorder we'll be talking about today is phobia. Phobia is an irrational fear of objects or an irrational fear of situation. Example, when somebody is scared of height, somebody is scared of flying, somebody is scared of spider, or somebody is even scared of snake. The number five type of disorder we'll be talking about is obsessive compulsive disorder, OCD. This disorder is characterized by unreasonable thoughts or fear that may lead to compulsive behavior. Example, when someone is always checking the door every 20 minutes before leaving, thinking the door wasn't closed. Or somebody is always conscious about his environment. Hey, this place is clean. And 1 minute is cleaning, the next minute is cleaning. He's always trying to make sure that that place is clean. Always trying to make sure that that place is well arranged in a particular time. Everything must be in order. The number six type of anxiety disorder we'll be talking about is post-traumatic stress disorder. This kind of disorder is associated with trauma. It's a trauma-based kind of anxiety. It's kind of a flashback to a situation where you saw before or something happened to you before. Yeah. The number 7 type of anxiety disorder we'll be talking about is separation anxiety disorder. This is often related in children, and sometimes it can also affect adults. This is when a child becomes excessively anxious when he is separated from his parents. How does anxiety show up in the body? There are ways that anxiety show up in the body. One of such ways is physical symptoms. The heart is always racing. You are sweating. There is always like a GI abdominal pain, an abdominal upset, or you are feeling headache. Sometimes it could be a result of overthinking. You're overthinking it. You have fear. You are restless. This could be related to a mental symptom. Another part to which this anxiety could show up in the body is a situation where the whole of your body is not at rest. As a nurse, it is important that somebody who is going through an anxiety disorder get an holistic care. When I say holistic care, I mean a care of the body, of the mind, of the soul. So today, we were able to discuss about what the types of anxiety and what examples of them. If you are struggling with anxiety, you are not alone. There are effective treatments, there are effective therapy, medications, and lifestyle changes that you may want to encourage yourself to go through. Like, comment, subscribe, and share for more mental health insights with compassion and truth. Thank you so much, and see you in my next one. Thank you.